Canada's healthcare system is spread across 10 provinces and 2 territories, and the needs it must meet are as big as the country itself, from providing care in downtown Toronto to helping patients in remote parts of the country. These competing requirements are well represented within the Extra program. My next guest is Dr. Nancy Whitmore, the Chief of Staff and Vice President Medical Affairs at St. Thomas Elgin General Hospital in St. Thomas, Ontario. Welcome, Dr. Whitmore.
Thank you, Pat.
First, I wonder if you could tell me a bit about your Extra project and what you're trying to achieve through it.
Well, the Extra program we're doing is a lean process redesign looking across the whole patient journey through the surgical services. So we're looking at the patient from the time they leave the surgeon's office, through the booking process, the registration process, through their trip in and out of the operating room, to their inpatient or outpatient bed, and then home again. And unlike most hospital improvement projects where we may just look at one tiny part of that, we're actually looking at that whole, what we call a value stream map from the patient's perspective. So it's a patient journey. And really what we're looking for is to see what parts of that journey add value to that patient and what parts of that journey are what we might consider non-value added or wasted time. And a lot of that time we know in anything we do is time that people sit waiting for service, waiting for the next step in the process. It's taking something that's been well known in manufacturing, where the Toyota production system, where we know just-in-time manufacturing, and applying that to healthcare. And the big advantage in doing that is looking at really improving, obviously, efficiency for the patient, better value for the patient, and most importantly, an improvement in safety, in that we know if we do less steps, that we can make a safer, more consistent process.
How hard was it to sell the idea of participating in the Extra program to hospital administrators?
Not very difficult at all, really, in that there's a huge advantage to the organization to have somebody participate in a program like this.
It's a win-win situation.
Oh, I think it's a win-win situation. The quality of the faculty, the quality of the education, the quality of the networking, it's really hard to meet in another program. So I think it's something that organizations are quite supportive of. It's you know, finding the right person that wants to do it. I mean, it is challenging. You know, I think management and leadership are challenging no matter what. They're particularly challenging when you're leading physicians who are all bright, independent, capable individuals. And if you can get them to help you along your path, it's phenomenal. Yeah. And they can be very, very helpful. And I've been very lucky to have a lot of support from my physician colleagues to make change, and it's been quite rewarding.
Now, you switched job positions midway through the Extra program, which meant you had to change your Extra project. How difficult was it to do that?
I was surprised at how easy it actually was for me to make that switch. I had started the program with the Here in Perth Healthcare Alliance, and there I was working in a role as a medical director for both the surgery and medical programs. And then I was recruited to St. Thomas to take on the Chief of Staff position and VP Medical Affairs. Extra was very helpful to me in giving me a lot of time to sit back and really think about what project made sense for that organization, and helped me acquire new mentors and get all of the help I needed to make the transition. So it was surprisingly simple.
Nancy, perhaps you could tell me a bit about how Extra fits into your own career plans.
Well, I probably don't have a standard sort of career plan for most physicians, in that I completed medical school over 20 years ago, did clinical practice for a better part of 10 years as an OBGYN, and then I went back to school and did a master's in business admin. And I really saw the Extra program as a chance for me to kind of blend my academic knowledge from my MBA with sort of healthcare organization and leading change, because that's really the challenge in healthcare. And I think over these next few years, we're going to see a major change in how we deliver healthcare. And I think physician involvement in that is critical. There's probably no more challenging job I've done, and I've done a variety of different jobs over my career to date. There's no more challenging job than, I think, healthcare leadership and physician leadership. So this, for me, was a way to acquire more tools to do a better job in leadership.
Nancy, you recently moved into a new administrative position. How difficult has it been to combine Extra with these administrative responsibilities?
Well, it's always a challenge. The time away from your job back home and away from family is a challenge. But it's certainly manageable, and for me, my intervention project is very much part of the strategic goals of my organization and the goals for me to deliver both to the board of directors and the CEO. So my intervention project is really part of my day-to-day work, and you know, so I think because of that, it works in reasonably well.
Nancy, thanks very much for joining us today. We appreciate it.
Thanks so much. I enjoyed it.